The Principal Secretary in the Ministry of Health, that is for Public Health and Professional Standards. This is Mary Muthoni. Good evening and thank you for joining us today.
Good evening.
Right.
Well.
Thank you. Let's just buckle down to business right away so that we can just get to have a lot of time discussing pertinent issues that are very, very critical.
Absolutely.
Yes, so let's just begin, first of all, just getting the lay of the land. If you were, and you will care to tell us how also the public hospitals, if you're to give them a red card, right, on a scale of 1 to 10, what will that be?
Wow, you've started with actually from the top. I thought we will do bottom up. You know, we start from the community going up.
All right.
But anyway, I am happy for that question.
Yes.
But really, I can say that our hospitals are exceeding expectations.
Okay.
If you look at where we have been before, you know, from other regimes and what we are having now, there is a completely different landscape. One, we are giving machines to all the hospitals, okay? And especially at the county level, especially the secondary facilities, CT scan machines, MRI machines. We have a whole conundrum of a program that is called the National Equipment Supplies Program.
Yes.
So there is no county that will claim that we do not have an equipment because we don't have money to pay. Because these equipment they are given for fee for service. Once we, the vendors take the equipment to the facilities, then you will only pay when you treat a patient using that machine. Secondly, if you look at where we are coming from, our facilities are receiving more funding than they used to. Remember, nobody has requested the counties to give part of their allocation, their budget allocation, to equip or to build or to do something. But what is happening is when patients are treated, then there is reimbursement that is given through SHA, which is additional funding to these facilities. And these days, according to the Act and the law, it states that we do not have to take the money of wananchi through other channels. The money goes directly to the facilities. So our facilities are actually performing better. You'll find a facility in Elgeyo Marakwet, a facility in Meru Isiolo, receiving as much money as 2 million shillings, whereas before they would have maybe 200,000 to just operate that facility. Get to human resources for health. You know, the employment of more staff, you know, starting with the PNP or the permanent and pensionable employment for the universal health coverage, people who have had contracts for the longest time possible, I think since 2018, they have now been converted to PNP. So really, these are just the engines that drive the facilities in terms of service delivery and also in terms of ensuring that the public are receiving the highest level of services that the government has offered. And why are we not talking about Social Health Authority? The 3 funds that we have had, that we've brought together. Initially, we used to have just NHIF. NHIF was just one fund, which could cater for everything. Maybe the kind of money that SHA has paid out to the facilities, NHIF would have taken probably 6-7 years for them to get to that rate. So again, the reimbursement of that funding through the SHA funds, and also the comfortability of having level 2, level 3, and level 4 outpatient being free for the members of public gives comfort to people. If you go to our public facilities today, they are actually the ones that are serving the people, because people have built in a bit more trust than it used to be there before. Then we have the SHIF, which takes care of the secondary facilities, and of course the ECCIF, the Emergency, Chronic and Critical Illness Fund, which now takes in or checks in when you have an emergency, when you have chronic illness, or when you have any critical illness.
All right. Right, looks like it sounds a very good salutary effort from the government, but also Kenyans, I know what is really hanging on the rafters of their minds this evening is the question also, as you're talking about funding, because there has been splashes about the 1.2 billion shillings that is being paid for a farm that is known as a Finsprint that we need clarity on as well, and we have Senator Okiya Omtatah going to the courts to challenge these particular payments, saying that 2% deduction applied to payments made by SHAs to hospitals under the government's mental health insurance. It's a bit shrouded in a fog of mystery that maybe you can clear for us this evening. You know,
really, Debarl, I see a lot of headlines about the healthcare sector every other day, which sometimes is very unfortunate because government works in very scheduled, steps, including audit that is done by the Office of the Auditor General. Sometimes, well, these stories come, but I think it is also very good to be very keen what is true and what is not true. These are allegations, okay? We will have to go through phases of investigation so that we can ascertain for sure that these monies have been taken away or they have been paid without due processes, other than just alleging in a blanket, blanket way, which can be damaging, and also in one way or another, if it is politicizing healthcare, I would really plead with whichever channel. It is good that we keep politics away from the health sector so that we are able to also give the wananchi indeed what they deserve. Because the more we feed them with negativity, the more they feel like they are not getting the services.
Maybe if there was a bit of clarity from it, then we won't be really embroiled in this, contestations that we do have, between the ministry and what is being challenged here, because they're saying lack of legal authority,
but equally,
lack of parliamentary approval, and also public participation. This has not gone through the due diligence.
Yes, clarity would come, but equally it also takes moral, conscience, that you want to splash all the bad things, but there's the 90% or 95% that is really good, which you could also concentrate on. The more you shout about that one thing you feel is wrong, I would also suggest that when things are right, please shout about them. I would have wished that one of the paper splashes in their front dailies that SHA is free, that SHA registration to SHA is free, that we have 3 funds, the primary healthcare fund, the SHIF, and ECCIF. I would really wish that one day that people that the same dailies they would also splash and say, hey, look here, that in NHIF we only used to have 20% of the population that would benefit, but right now we want 55 million people, all Kenyans benefiting, whether you come from low end or the high end. I would really wish to see the dailies and also the media talking about that if you register today and you go to a health facility, you'll be treated immediately. In fact, if you're sick today, Debarl, and you're here and you're not registered to SHA, we will register you as we go to the hospital and you will get treated immediately you get there.
So we get assurance from you that billions have not been...
I want to assure Kenyans that we do not have any shortchanging of mwananchi's money that we are dealing with at the Ministry of Health. And I would really want to keep reminding the wananchi and everybody else, and you are in the media, we want you to be our voices, that indeed take that which is good, and if you feel something is not working, I want to plead with everybody, please bring it up so that we can be able to assist. It is important that the health sector becomes one of the shining stars for the mwananchi of Kenya today. Yes.
Okay, so is it sustainable? That's also the biggest question that everyone is asking.
Absolutely.
And what are the modalities that are going to make it sustainable?
Absolutely, SHA is sustainable. And I'm going to take you through phases. The one thing that the government did when we came to place, or when this government, led by His Excellency William Samoei Ruto, came to place in 2022, was to place in the laws. One was the Primary Healthcare Act of 2023. The Primary Healthcare Act is the one that holds even the community health promoters. Remember, initially, CHPs never used to be paid a stipend. They never used to have a kit. They never used to have phones. They never used to have anything. They would just walk into the villages and possibly just talk to the people. They used to have big books, you know. Right now, they have a phone, digitization. They have a kit that has even commodities. They have, they register, okay, there's digitization, they have a phone, they have a kit, and they also are recognized. Apart from all the other things, they are recognized by law that the CHP is somebody working at the community level. Then we have the Digital Health Act of 2023. Initially, and especially those who have grown during my times, we used to have quota exercise books. Everybody in your family, when you're going to hospital, you carry your quota exercise book and you go, you're treated, the doctor would write on that book. Today, you only need your finger and your ID. You go to facilities, whether you're referred or not, you will find your name there because you have registered to the Social Health Authority. Today, we have Facility Improvement Financing Act of 2023. The FIF is supposed to ring fence the funds that are meant for the for healthcare. Initially, county assemblies and national assembly, they would realize some funding which is floating, or when there's an emergency, the funds that are, have been kept for probably immunization, yes, it's taken away because there's an emergency, there's a bridge that has broken or thereabout. Today, you cannot move even a shilling because of facility improvement financing, which is supposed now to go back, deal with facilities, improvement of infrastructure. You'd go back and improvement in terms of healthcare workforce, in terms of commodities, in terms of equipment, all right? And finally, we have the Social Health Insurance Financing Act of 2023. So the Social Health Insurance Financing Act, one, it has 3 funds. And the 3 funds will work in tandem. The first one being the Primary Healthcare Fund. The Primary Healthcare Fund basically is exchequer driven. So it is the government that pays for you. You don't have to pay, okay? You only need to register. Once you register in level 2, level 3, and level 4, outpatients, it's free. And that is why initially when we started, there was a lot of commotion because people did not know how the Primary Healthcare Fund works. Even the facilities, some of them were confused about the Primary Healthcare Fund. So people would go to hospital and you're told, pay your registration. But through civic education, we have been able to demystify that and ensure that members of public know their right. The second fund is the Social Health Insurance Fund. That is our Harambe. Okay. And our Harambe, what we are saying in our Harambe is you pay depending on your capability, okay? I am a PS, I work in the government of Kenya. My 2.75% of my salary is deducted on a monthly basis, whether I'm sick or not, whether a family member is sick or not. And same case to yourself. But if you go to the people in the informal sector, then we get your means testing. We get to see how much you earn, and we are able to get part of that money to our Harambe, which is the Social Health Insurance Fund. Then that takes care of our secondary in our secondary facilities for treatment. If you go and you're admitted in a facility, then SHIF checks in immediately. And that is why we are also encouraging members of the public. It would be important to pay for a whole year so that not a single day you go to a facility and you're not treated. Then the final fund, which is going to make SHA very sustainable, is the Emergency, Chronic and Critical Illness Fund. Yesterday, His Excellency, the President of the Republic of Kenya, launched the 922 emergency ambulance.
Yeah, we'll come to that much later.
I know you'll come to that.
Yes.
But you know, I want to let you know that it is part of the Emergency, Chronic and Critical Illness Fund.
Okay.
The Constitution of Kenya, Article 43(2), dictates that every Kenyan has a right to have an affordable, acceptable, available, quality health care. So from primary health care to emergency to chronic illness, it is a whole line of care for every Kenyan.
Right, but hobbling also this care, we can see are the strikes. We have the nurses who are striking, health workers in the labor market have intensified also their pressure on the Council of Governors to also fully implement their collective bargaining agreement, which I know there's complementary working between the national government and the county governments.
Yes.
But can you tell us how this also is affecting the rollout of just the healthcare system in the country?
Well,
just
indeed,
briefly.
yes. Indeed, we have had several strikes because of healthcare workers being dissatisfied. However, if you look at the landscape right now, we have really reduced at the national level, that national strike that used to happen. And what is remaining now is the specific counties on being probably different issues. It could be promotion. It could be in regards to probably the quality of care. There are different issues that healthcare workers would strike because of. And we will need to go to the different counties specifically. Let us not generalize and say that the healthcare workforce has really been affected everywhere.
Thank you.
Because these are different governments.
Right.
So we want to go on to each, whether it is Bomet or any other county, and really find out why are the nurses not contented with what is being offered by the county government, the specific county government, and what can be done.
Right.
But moving forward, I know we are very keen to standardize issues of healthcare workforce, because that is what is going to kill all these strikes. I know several counties have several or different public service boards, but we will need to see how do we standardize the issues of healthcare workforce, whether it is in terms of retention, in terms of employment remunerations, in terms of career progression, there are many areas. Therefore, we are on it, and the coordination with the county government is on another level. However, for the few counties or the counties that are having issues right now, we will dig deeper and find out how to assist them.
All right, I know you don't like tooting your own horn, right? But allow me to toot your horn as well. I congratulate you, because I can see you been elected as a chairperson of the African Permanent and Principal Secretary for Health, right?
Yes,
which is, I reckon that is a proud moment for Kenya, and also a strong vote for confidence in our country's leadership on public health as well.
Absolutely.
And I would just want us to, maybe you can tell us, what does this really entail? And in light, maybe this will segue also to a discussion on the Ebola outbreak and how we're containing it.
Well, I think COVID taught us a lot, and especially in the continent of Africa.
Yes.
Where we had money, but we could not even access drugs. That's just one aspect that I'm talking about. And there are many other issues. So what we want to see is a continent that is coordinating. The neighbors know what each other is doing in regards to public health, whether it is in the standardization of public health officers or healthcare workers. We need, when there is an outbreak, if it is in Uganda, we are able to go and also assist. You know, we want to see surveillance along our border points. We do not want Kenya is doing the right thing and Uganda is not doing. So we want that coordination strengthened. We want to see issues of procurement done the right way. Pool procurement, for instance. You can imagine if in Uganda there's an outbreak and in Kenya there's an outbreak, and Uganda manages to buy their PPEs earlier and Kenya we are left out. You know what that means. Pathogens have no boundaries. So we would want to see even procurement of goods and services. We can be able to come together. If we mean to buy for the EAC, we buy together and distribute at the same time so that nobody suffers at any given time. It is the high time that we discussed about data in these countries, because data is everything these days. Data will help you plan better. Data will help you know how much money you require as a country, as a nation. And if you need to resource mobilize outside your nation, then you need that data. But you cannot work in isolation.
Indeed.
Even with your own data, you cannot work in
just
isolation.
maybe to
so
ask.
The countries have come together with our partners to ensure that some of these issues are collated together and we are able to move together in the same similar direction.
Just as we're speaking of, we know that the director of the World Health Organization, Dr. Tedros, right now, he's made his second visit in DRC. The numbers are rising exponentially. Historically, this has never been, just looking at the figures, 3,900 Ebola cases. We have 1,750 deaths in just a few months, which is making it one of the fastest growing Ebola outbreak on record. So I just wanted to know, even as you're talking about, synergy and collaboration and engagement with other stakeholders around, the East African region. You now being on this particular, position, what immediate continental actions will you champion to prevent the crisis from spreading further? But we begin here at home as well.
First and foremost, you begin from home.
Yes.
Before you go to your neighbor.
Indeed.
And the one thing that we have done since COVID time is our country has really enhanced issues of surveillance, especially at the border points. There's 26 ports of entry. If you go to JKI today, we have also improved in terms of screening. We even have digitized self-screening that is going to help every passenger to ensure that they are able to, if they are getting into the country, we have your data and we know your status. Secondly, we are continually training our healthcare workers. In 2014, you may know very well that our healthcare workers, more than 100 of them, even went to West Africa to assist on Ebola. So we still have very highly trained healthcare workforce in our country that can deal with a surge in case of any. And we are continuing to train more so that that number can grow higher. Indeed, our coordination with the county government, which is very, very important, and that is why isolation centers, emergency operations centers had to be, they had to be reignited and to make sure that they are operational. And the county governments are alert on any. If there is any outbreak, that we need to ensure that they are taken care of. Indeed, it is the high time that we also thought about budgetary allocation on some of the emergencies that may happen in the country.
Yes.
And we are very cognizant of that. Initially, the budgets for public health used to really, really be low. Right now, out of the 175 billion that is allocated in the Ministry of Health, at least 24% goes to public health, which is a significant improvement from before. And we will keep continuing to give the members of the public the information that is required, risk communication. We'll keep telling you, please clean your hands, please make sure your environment is clean, please make sure that you take clean and safe water, and of course use your sanitation. The stakeholders have already been sensitized across the country. May it be hoteliers, may it be truck drivers, may it be anybody who socially meets with people who also travel a lot. And we are also urging Kenyans, if you do not have an urgent travel, please then don't go.
Refrain from.
Yeah.
Okay, so they were talking about public awareness. I still wanted to ask, do we have any, from your own assessment, any dangerous gaps in community understanding of Ebola from your own assessment? And what is the ministry trying to do to really up the ante in terms of risk communication that you're really talking about? Indeed,
you can never be 100%. At least we can be 95, 90, 97, 99. But it's not, you may not just be 100%, and we accept that. Especially on areas that are very critical. Our infection prevention control is still very low in Kenya. And you know that calls for members of public to be sensitized more. Issues of hand washing, issues of, you know, high levels of hygiene at any given time. So that is why I'm here, Debarl, because this is part of
the communication.
The communication that you're talking about. And indeed, whoever is listening to me today, they need to know that tomorrow in the morning you wake up, wash your hands. You go to work, wash your hands. You go back home, wash your hands. Those women who are going to hold a baby, you know, in our Kamweretho, they need to wash their hands before they touch that baby, you know. And this is not a joke. It needs to be taken seriously by every Kenyan, everywhere.
Right. It's a relief to note that, of course, even from the samples that you've done, so far, none of it has really come positive. Out of 173 samples tested,
absolutely,
it came from also Busia, 35 from Luakaka, 2 of Kenya's busiest borders as we know it. So do these also numbers reflect a surveillance system that is sufficiently robust to detect imported cases early, or is there maybe some wiggle room to strengthen our border health security from your assessment, just briefly?
You see, by the virtue that we have samples coming in, it just tells you how strict and how enhanced our surveillance is. If we were getting 0, then we should be worried. But if we are getting numbers still rolling in, then that tells you that our borders are really tight, and we are able to detect any kind of ailment or disease before it gets into our country. By the way, I also want to tell you that at the airport, we also deal with we pick the wastewater, the aircraft wastewater, and we are able to pick on the pathogens to detect the disease patterns that are likely to come into our country. May it be cholera, Ebola, even COVID. We can test in our labs today. Today, I can tell you that if we have a case, if we have a sample, between 6 to 8 hours, we are able to give you the results. And we are able to tell you whether it is it is a confirmed case or it is a negative case. During COVID, you could get one sample and it would take you 1, 2, 3 days because we would send it to South Africa, to UK, to India, and then it takes days. You know, today we have a sample. We have a sample 6, 8 hours. We know whether it is. We know the results. Therefore, that just tells you how much we have been able to. The capability of our laboratories has really, really improved. Yes.
Fantastic, and I think is a good salutary effort. But I just wanted to know briefly, even as we're winding up on the Ebola bit, because the World Health Organization is saying, the outbreak is becoming more faster than the response, right? And it's a good thing that none has been detected here so far.
I think in Kenya we are faster than the outbreak.
You are faster than the outbreak.
Our response is faster. Yeah, because we have been able to really tighten a lot of things, and we've been able to be set. Our coordination regards to healthcare workforce. We are just having a group of healthcare workers that should there be even a single case, then they'll just move in. Yeah.
Interesting. All right. Just briefly, because they were saying, before even they had actually announced the first outbreak in DRC, the virus had been there for 4 months, right? Undetected. Also raising questions regarding maybe the contact tracing. Just briefly on that as well. Could there be sometimes, this flash of virus spreading and people are not really aware until we detect the first one?
Yeah. Our healthcare levels at national level, different nations, is very different. Whereas the incubation period for Ebola takes a little longer, 21 days, we have been able to do a lot of contact tracing, at least for our country. Yes. Whoever comes in and you're suspected, we do a lot of contact tracing. You have seen there's even a group that went to Congo, and I think they had gone to wait for the president. And when they came back, we had to put them in quarantine because we did not want to take chances. So the same case continues. Because we are doing screening at the ports of entry, should we see that Debarl has signs and symptoms, we keep following up within that period of 21 days, just to ensure that issues, you're okay. And if we had time, I would take you through the kind of screening that we do at the airport. And even if you say, I have a fever or I have a mild headache, then the system or the digital system will keep asking you questions on a daily basis to say how you're feeling. Today, are you still having a headache? Go to the nearest health facility. What I would urge Kenyans is, if you feel unwell, don't run to the chemist. Please go to a health facility and get prescribed the right medication.
Fantastic.
Yeah.
All right. I want us now to talk at least teased out the issue of a national ambulance dispatch center, so that you can also just maybe give us a rich stream of information what it really happened, aside from the funding that you actually talked about. President just launched it yesterday. This is the first ever national ambulance dispatch center for many Kenyans. Okay, this sounds like a major milestone, but what practical difference will it make when someone dials that number? Is it 922?
922. The 922 number will do one thing. This is a single dedicated number for emergencies. If you dial that number, it will go through whether you have credit, airtime or not. It is free.
It is free, okay.
It is a free toll number.
Maybe I can try it right now. To see if what you're telling me is... let me try. I hope...
Just make sure we don't take you in because of lying.
Let me see how it works, actually. Okay, so that we can get for any Kenyans who want to try and test and see.
So if you dial that number, it is free.
Okay.
Calling the National Ambulance Dispatch Center.
Yes, it is.
To help us respond to your emergency, we'll automatically collect your location information to dispatch an ambulance. If you agree for us to use this information, please press 1.
Okay.
If you do not agree, please press 2.
Okay, I agree. Let me see. Okay, what goes on from there? This is an emergency?
And Dr. Miriam on the line, what's the emergency?
All right, thank you very much. My name is Debarl, Inea. I'm just testing to see if the line is working. So I wanted just to confirm.
And
that,
you're on air with the PS.
Yes, I'm on air here with the PS.
Debarl.
Mary Muthoni. So I just want to see, is it activated or will I also be kept for long? Thank you for actually being quick off the mark to pick up the call.
It's okay.
All right, and who am I talking to?
You're speaking to Miriam.
Miriam, thank you so much. I really appreciate. Tested, it's working. What's my emergency?
Are you good?
I am good right now. Right. Okay. That is working. 922. You can call it.
922.
Yes.
Now I can speak louder.
Please. Now you can speak confidently. Right. So tell me, how is the center?
The other thing is no health facility should deny you services.
Okay.
Or even delay you services because you do not have money. Because within the first 24 hours of being taken to that facility, you're supposed to be stabilized. You're not even supposed to be asked what's your ID, what's your phone number, where are your relatives. Treat the person, kesi baadaye.
And this is 24 hours?
Yes, for the first 24 hours.
For the first 24 hours.
Within 24 hours, any facility can be able to stabilize an emergency. Then after that, that is when you can ask the person, are you registered to SHA? Then you can transfer the person to a facility where they can be treated using SHA.
If they are not?
If they are not registered, you register them. And when you register them, either you're taking them to the primary health care, or if they are checking into the shift, then you take them to the secondary facilities. If they are in critical condition, then emergency, chronic and critical illness fund is still there to check in.
Okay. So tell me then, how is the center expected to coordinate ambulance services across all the 47 counties?
All ambulances, whether from the county government or from the private sector, they are supposed to be accredited through our system. And KMPDC checks all the ambulances to accredit them, just like facilities. You know, this is actually, an ambulance is actually a moving facility. It's quote unquote. It's a moving facility because it has a healthcare worker inside, it has equipment inside, it has oxygen, it has all those things. If you have an ambulance, what you can say, a quality of or high level ambulance, standard ambulance. So when it is accredited, then you are able to, we are able to reimburse funds when they take a person to a health facility. A certain amount of money is reimbursed through SHA to the owner of the ambulance. So even you can own an ambulance, and then it is accredited. Then whenever it is because this is digitized and through geo mapping, if you call for the ambulance here, the system will check your location, and they'll be able to pick or to check on the ambulance that are near you. Then one of them will be assigned to come and pick you from wherever you are. Then you'll be taken to the nearest facility that is there. So this is just like Uber. It is a medical Uber.
A medical Uber.
Yes.
Okay. Maybe just to reassure Kenyans as well, because we've had, and this will be my last question. If I want to access this facility and I do not have the funding, I'm in emergency, do I need to make any down payment? How does the process really go? It is for free, because I can see also you're partnering with the private farms, isn't it?
Yes.
Right? Any person who
Remember, I'll take you through the phases again.
Please.
When we made the law, that is the Social Health Insurance Financing Act of 2023, we came up with 3 funds. And I want you to listen to this one. 3 funds. The first one is the Primary Healthcare Fund. It takes care of the lowest level of our facilities. That is level 2, level 3, and level 4. Outpatient is free because the government of Kenya allocates money to that fund. Okay? Then when we check into Social Health Insurance Fund, the second fund, that is our Harambee. Me and you, we put the money together. So when you go to a secondary facility, okay, where you need to be admitted, then you need to have paid to the Social Health Insurance Fund for you to be attended to. Then we have the third fund, which is Emergency, Chronic, and Critical Illness Fund, ECCIF. It is government paid. You don't pay anything for insurance. You do not pay anything if you have a seizure in your house. You don't pay anything if, there are those illnesses that are rated as emergency, okay? So you won't pay anything because the government has already allocated money for that. What happens when you're taken to hospital? Because this ambulance is contracted, remember it's a facility, it's a moving facility. Okay. Just like we are accrediting Kenyatta, Mbagathi, and any other, we have accredited this ambulance A and ambulance B. When they take you to the facility, you will be given a certain amount of money to continue running your quote unquote moving facility, which is the ambulance.
Okay.
Makes sense?
Makes sense.
Makes sense? So you don't need to ask this person money. He doesn't even have to have registered to SHA. This guy only needs to be dropped by you.
All right.
And then you go and ask SHA, I have dropped this person and you followed me throughout because you have the geo mapping, okay? The system followed you. You know how many kilometers
you've covered.
I covered. So pay me the money. And it is calculated very well.
Okay. So we have to wait for the system and maybe now for also to give us the feedback, since it was just rolled out yesterday.
But the system is working.
Yeah, it is.
You have called.
Working. Yeah, I've called. No. I've not even said that don't have an emergency. So I want maybe a case, in point where someone has an emergency and
you want a case in point
who has gone through the rigor of a system to actually verify what you're telling us is true. Because now sometimes we might be having some teething problems. Some of the contractors saying, we've not been reimbursed, so we cannot, pick up this particular emergency.
That's a different case.
That's what I'm saying. Yeah. How then do we counter such challenges ahead?
Every project has teething problems. Let us hear the feedback from the members of public or whoever who will use the services. It is very good to have feedback. So I would actually be very happy to hear that somebody tried the number. Well, you tried the number, but you cleared the air, you just wanted to find out. But anybody who has tried out there, it would be good they also give you feedback so that if there is a problem, we will be able to rectify. At the end of the day, we really want every Kenyan to have an accessible, available, affordable, quality healthcare.
Indeed.
Yes.
Thank you. PS Mary Muthoni, just to give you maybe your closing remarks, looking at that camera, assuring Kenyans, especially on the big watch of the Ebola outbreak, what will be your last sentiments, and reminding also Kenyans on the 922 number that they need to call?
I want to assure Kenyans that the Ministry of Health is stable, it's steady, and we are working for the common good and the common goal of the common mwananchi. And we are very committed to ensure that quality services are given to every Kenyan from whichever corner of the world or corner of the country that you're coming from. Equitability of healthcare is a right for every Kenyan, and that is what we are working towards. On issues public health, please remember to wash your hands. Please remember to keep your surfaces and your environment clean. Please remember to take your clean, safe water. And please remember sanitation is very key. In this country, we still have about 15 counties that practice open defecation. We would want to close in that gap. Many ailments today at the community, they come because of poor hygiene. Let's close in that gap together.
Thank you. Right.
And I am inviting every Kenyan, all Kenyans, to our first ever, the inaugural Kenya Health Summit on the 18th and 19th of this month.
Where is it going to be?
It's going to be at KICC.
At KICC.
Yes.
All right. On the 18th, mark the date. Thank you very much. Always a treat, of course, having discussions with you, PS. We really do appreciate. And remind.
Oh, we have finished?
Yeah, we're finishing.
Oh, I thought we were starting.
We're done. We're done. Right. Thank you for allocating some time to just come and highlight some of these issues as well.
Yeah.
And be reminded of 922 as well, the number that you need to call. And that is all about the National Emergency Dispatch Center. If you are in a challenging situation and you need emergency services, that was rolled out by the government yesterday, and this is also what the PS was trying to illuminate and shed light on as well, for you to have an easy access. We've tried the number on air, you verify that it's working, so utilize the facility. Thank you very much for your valued company. You've been watching TV7, of course, Prime, and I wish you a good night, sleep easy, and have a lovely day tomorrow.